Hi everyone. Today I am going to discuss about polycystic ovarian syndrome. So, polycystic ovarian syndrome first described by Steen and Leventhal in 1935. Incidences are 5 to 10%. So, it's a main leading cause for female infertility and amenorrhea. Polycystic ovarian syndrome is a hormonal disorder which affects ovaries in the woman. Let's see the introduction. Polycystic ovarian syndrome, it's a complex endocrinal disorder which associated with long-term anovulation. Anovulation means absence of ovulation. Excess circulation of androgen, that is in the blood. Androgen is a male sex hormone which is present in the female too. The syndrome is characterized by formation of cyst over the ovaries. So here you can see normal ovary and polycystic ovary. Here you can see development of follicle. First it is in primordial follicle, then it becomes primary follicle, next secondary follicle, and then mature follicle. And ovulation will occur. But coming to the polycystic ovaries, the development of this follicle will be stopped. There is a multiple immature follicles we can see, and which may cause many cysts on the ovaries. Let's see the causes. While the exact cause is unknown, doctors believe that hormonal imbalances and genetics play an important role. Excessive androgen production by the ovaries and result of hormonal imbalance which is continued in follicular development, elevated estrogen level, anovulation and multiple cysts can be found. So how we made the diagnosis, how we will find out that PCOS is present in the women. So diagnosis made on any two of the following: oligo or anovulation. Oligo, that means less ovulation, less cycles of ovulation. Anovulation, that means absence of ovulation. And hyperandrogenism. There is the excessive androgen levels which I have previously said, and polycystic ovaries, where are many cysts on the ovaries. With this we can find out there is a woman is suffering with PCOS. Let's see the clinical features. Mainly obesity, central obesity, especially central obesity, that means obesity at the abdomen. Mostly this will be there for the 19 to 25 years of age. And menstrual abnormalities like oligomenorrhea, amenorrhea, dysfunctional uterine bleeding. So this can be seen. Infertility. Obviously, if there is no ovulation, then it may cause infertility. Next is the hirsutism and acne can be seen. So here you can see the picture hirsutism. So which is an unwanted excessive hair growth in the woman either on the face, chest and back. Chin also you can see. Next is the acanthosis nigericans, which is the skin pigmentation characterized by the dark velvety thick patches on the skin usually formed in the skin fold. Let's see the diagnosis. Definitely sonography is a very important. Transvaginal sonography will show enlarged ovaries with many cysts arranged in like a small cyst can be arranged on the cyst like in the ovaries. Next is the serum values. LH, luteinizing hormone, which is elevated. LH level which is elevated, and also FSH, follicle stimulating hormone, which will be in ratio is disturbed like 3:1. 3:1 can be seen. Next is a raised level of fasting insulin levels and raised serum testosterone, that is beyond 150 nanogram per dl. Beyond 150 nanogram per dl. Next is a Raised fasting insulin level. So here raised fasting insulin level is 25 micro international unit per ml. Obviously, there will be raised level of prolactin and laparoscopy. Bilateral polycystic ovaries we can find out through laparoscopy. Treatment. Coming to the treatment, medications, that is drospirenone. Mostly the gynecologist or obstetrician will uh, prescribe birth control pills. These pills alleviate the pain, regulate the menstrual cycle, reduce level of male hormones like testosterone, and mostly people have doubt that why we have got PCOS, but why we have got birth control pills. So it will reduce the levels of testosterone and anti-androgens. These drugs bring down the level of androgen, that is spironolactone. And fertility drugs quite conducive for administrating and expediting ovulation among women who are facing fertility issues due to the PCOD. Correction of biochemical abnormalities with combination of oral pills, which is gonadotropin releasing hormone agonist, medroxyprogesterone, which is called Provera also. Next, ovulation induction. So this ovulation induction is done by giving clomiphene citrate or without dexamethasone or bromocriptone. Next, for patient with hyperinsulinemia, metformin is given with clomiphene. And definitely there should be a lifestyle modification who has this PCOS, that they have to take low caloric diet and they have to walk brisk walk like 20 to 25 minutes daily. Apart from this, surgical management. There is an endoscopic cauterization and carbon dioxide laser vaporization of multiple cysts. Through this cauterization, the cyst will be removed. Let's see the nursing process. So already we have know that what all the steps of nursing process: assessment, nursing diagnosis, planning, implementation, evaluation. Let's see the assessment. So nursing assessment for pelvic condition involves, first you need to assess the risk factor, and definitely menstrual history should be taken, all the gynecological history, presenting symptoms, data from physical assessment, laboratory tests. This all should be considered into assessment. Let's see the nursing diagnosis. Pain related to pelvic condition, fear related to procedure and treatment, anxiety related to effects of condition or treatment, anxiety related to future childbearing, and deficient knowledge. So mostly the women, they will be having anxiety related to future childbearing. So what can be done? What will be the nursing interventions or care plans? So first you need to develop strategies for coping with the pain, reduce stress and promote wellness by following exercise regimens, consume recommended food to control obesity and maintain optimum body weight, return to physician for follow-up care. So these are the planning and intervention should be done. And apart from this, complication may also arise, that is risk of developing diabetes mellitus due to insulin resistance and risk of developing endometrial carcinoma due to elevated levels of estrogen. Hope you people have understood. If you have any kinds of doubt, please comment. Thank you.